It is pink in the studio for a reason. October is Breast Awareness Cancer Month, and we're going to be talking about prevention, how you can also treat the disease, and also how we can help.
Yes, a very important month devoted to education, the importance of early detection, and access to quality care. So to get us all on the same level, I wanted to start with some basic numbers. So first off, breast cancer. It represents approximately 30% of all cancers. And also, unfortunately, it's the most common cancer diagnosed within the United States. That equates to approximately 240,000 women and almost 2,000 men each and every year. The incident rate we've seen in recent years, unfortunately, has increased by about 0.5%. Secondly, risk factors. The most common risk factor is age. The median age of diagnosis is the age of 62. That means that half of those diagnosed are under the age of 62. Also, inherited genetic risk factors, family history, first-degree relatives with a history of breast or ovarian cancer, and those who have dense breasts. And to be specific about that, breast density is diagnosed on imaging. It's not something that can be diagnosed on exam.
You got to get your imaging done.
Got to get the imaging done. Bringing it to that screening, screening and discussions about screening should start at the age of 40. And most people don't realize it, but most insurance coverage, it should be all, cover mammograms every 1 to 2 years for women at the age of 40. It's important to understand your coverage the very same way that you understand your bank account. And then I think the most important number is survivors. Right now in the United States, there are more than 4 million women and men that are surviving breast cancer and currently undergoing treatment. And I think that number is the most important, especially to draw on that collective strength.
They are thriving, and early detection is key.
Absolutely. And many don't realize it, but if you find breast cancer at the earliest stages, your 5-year survival rate can be as high as 99%. So start that discussion about mammograms, get in there and make sure that you just get all your questions answered.
And look, I can say it can be scary to go in and get that imaging done,
Terrifying.
But it's so much more important to do it now and catch it early.
Yes, get it out of the way. Unfortunately, in the emergency room, I'm usually at the very beginning of many stories of their breast cancer when they're finding masses and trying to understand what can be the cause. And again, getting it out of the way is so key, so important. Don't put it off. It's your health. Treat it as the most important thing in your life.
Can't say it enough, Doc. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.